New drugs, new treatments, new techniques, more people, older people, less healthy people, and new expectations of health services for convenience, for control, and staff wanting to deliver the latest and best in healthcare. With lifestyles changing, obesity levels rising, and patients becoming more and more like consumers, the NHS begins a fundamental review, building on the positive results of the massive reform programme of the last few years. Led by clinicians at local level, involving local staff and patients, putting local services at the core of future developments through its 60th anniversary and the decade beyond.
This is not about organisational change, this is about improving clinical services. And the really important thing about this review is it's going to be based on the interest, the knowledge, the understanding of our patients and our staff in a way that we've never done before. Over the last 10 years or so, we've made some massive improvements in healthcare for our people. We've saved tens of thousands of lives through improvement in services, cancer services, cardiovascular services, community services, mental health services, a whole range of improvements. One of the distinctive things about this review is the way in which we're going to engage with our staff and our patients and our communities. We're going to set up across the whole country a whole range of opportunities for people to make their input, to say their piece, to have the debate and the discussion about priorities, about what clinical services might look like, about the way in which services are going to be delivered locally to patients. And the great thing, I think, about this review is it's led by a practicing clinician who is also a government minister. Our Adazi, through this process, will not only have the responsibility to listen, but also have part of the responsibility of delivering the change.
This review has two components. There's the national component and there's the local component. It's clinically led at a local level, and what we're trying to identify throughout the 10 strategic health authorities is a process in which we can engage clinicians and other staff to design the best models of care. I envisage within a year that each strategic health authority will produce a vision statement identifying best practice, best delivery models, tackling some of the issues including improving quality and outcomes, improving access, and finally dealing with the inequalities in health and healthcare. Now, at a national levels, there are some major themes, some major engagements with the national bodies dealing with issues, for example, in quality, such as standards that we should expect within the NHS, some major challenges that might be facing the NHS in the next decade as far as education and training is concerned, and also another theme around clinical leadership and engagement.
My first thoughts about the National Review was, here we go again, actually. And it's only since I've become involved more in today, for example, and a previous event in London, that I've sensed a different atmosphere to them.
I would like to see them actually look at what is there before they start making changes, because there are examples of really good practice which are just growing, they're developing, but there's good practice out there. And if you could say one thing, it would be to ask the people who deliver the care, ask the people who receive the care, what is good.
For me as well, you can tell I'm a little bit passionate about this, is to acknowledge the skills that we got, acknowledge the volume of knowledge and expertise that we've got.
I think it's important to take stock about changes when you've been through a phase of implementing a lot of reform, and have a sensible debate about what the next stage should be.
The review has 4 challenges to meet: helping to put clinical decisions at the heart of how services are delivered, improving the quality of care for patients and also maintaining their dignity and improving their safety, making services easier and more convenient to get to and delivered in the right place for the patient, building a vision for the next 10 years in time for the 60th anniversary of the NHS next year, a vision which concentrates on patients and on local accountability. And there's one more element: to look at whether the NHS needs a constitution, a written framework which protects the values it has always stood for.
This review is not going to be dealing with organisational change. I think we've had enough organisational change, and as the Secretary of State said, we're going to go through a period of stability. What this review will change is the way we deliver care to our patients, very much based on the principles of improving quality, improving access, and meeting some of the challenges of inequalities in both health and healthcare throughout the NHS. And what we're trying to capture is the innovation that already exists at a local level and build on that to move the NHS into the next 10 years.
The review will develop using a route map made up of 8 clinical pathways. The pathways are birth, children, staying healthy, long-term conditions, acute episodes, planned care, mental health and end-of-life care. There will be local groups looking at each clinical pathway in each SHA who can champion local initiatives and local needs and help to spread best practice. Each group will involve doctors, nurses, midwives and other health professionals. They'll need to capture the imagination and the insights of staff, patients and the public to design models of care that truly fit their local area. The next step involves 9 discussion forums across the country where the public, patients and users and staff will discuss the priorities for the review. Building on those discussions, there'll be an interim national report in October. Then detailed work will begin, involving staff, patients and the public at local level, led by the local clinical pathway groups. In December, there'll be more discussion forums for the public and staff to debate the issues identified by the clinical pathway groups. That will lead in January to SHAs producing their first vision of what local services should look like. And from February, where appropriate, the local NHS will run local consultations with the final versions of their vision statements published by June. The final national report will also be launched in June.
Our staff are going to play a vital part in improving services to patients. So I would absolutely encourage people to get engaged. Where there are local meetings, where there are local stakeholder discussions, get along to them. Make your voice heard. One of the really good opportunities available in the review is the online questionnaire, and there will be details later in the DVD about that. That's a really good opportunity for you as an individual or groups of staff working together to identify what you think the top 3 priorities are for the review as we take it forward, and also what you think the top priorities of your patients are.
I hope every member of staff would engage in this unique opportunity and get involved and contribute to this very important debate and make change happen at a local level.
You can visit the review's dedicated website pages at www.nhs.uk/RNHS, where there'll be full details and updates. If you'd like to be kept informed by email, drop us a line at rnhs@dh.gsi.gov.uk. There'll be plenty of opportunities to get involved, but the first step for you and your team is to complete the online questionnaire at the website. We've set out some of the issues we think might be on your mind, and your patients' minds as well. But if there are any other issues you want us to consider, the online questionnaire has space for those as well. We're looking for the top 3 things your patients and users would want us to look at, and the top 3 things you and your team would want us to look at.